Welcome to Case Closed, a video series that explores real TMLT medical malpractice cases. My name is John King, and I'm a Senior Litigation Supervisor at TMLT. The following case illustrates how action or inaction taken by the physician led to allegations of professional liability. In this video, risk management techniques will also be discussed that may have either prevented the outcome or increased the physician's defense. A 55-year-old woman was admitted to the New Mexico hospital for colostomy reversal. Due to the patient's dense adhesions, the surgeon first attempted to perform the surgery laparoscopically, but the surgery was converted to an open procedure. The surgery took more than 12 hours. Due to the incorrect sponge count, the surgeon ordered an X-ray at the time of closure. X-ray images were sent electronically to a radiologist in Texas. The radiologist could not tell from electronic files whether or not sponge was present. So he called the hospital and was connected with the operating room. An unidentified person told the radiologist his missing sponge had been found on the floor and then hung up. The radiologist dictated a note that no lap sponge was detected on the images. The electronic images of the plain film were not definitive for the presence or absence of a sponge. A week later, a CT scan of the patient's abdomen indicated a foreign body. The patient was returned to surgery and a retained lap sponge was removed. The patient ultimately recovered. A lawsuit was filed against the radiologist, the New Mexico hospital, and the surgeon who performed the colostomy reversal. The allegations were failure to recognize the presence of a retained surgical sponge, the need to undergo additional surgery resulting in complications, prolonged hospitalization, and unnecessary pain and suffering. The radiologist told his defense counsel that he did not recommend a CT scan or further investigation because a sponge had been reported as found. Two radiologist consultants for TMLT reviewed the radiograph film. Consultant 1 said he did not see a radiopaque marker that would confirm a retained sponge. Consultant 2 was unable to read the images at all. The defendant surgeon said he decided to close the patient's abdomen based on the radiologist's negative X-ray report.
Hello, my name is Robin DeRocher, and I'm a manager in the Risk Management Department at TMLT. According to the radiologist, he called the hospital and was told the sponge was found on the floor of the OR. He said if the sponge was still unaccounted for, he would have recommended a CT scan since the plain film was not definitive for the presence or absence of a sponge. Unfortunately, the radiologist did not document this conversation. Also, he did not document his concern about the images or his thoughts about a CT scan. It is very important to document all communications transmitted or received by the physician about which a medical decision is made. Doing so provides increased defensibility should there be a poor outcome. In addition, when documenting phone calls, include the name of the person you spoke with. In this case, it would have been beneficial to have the name of the person in the OR who told the radiologist that the missing sponge had been found. The American College of Radiology has created 2 guidelines for creating a diagnostic imaging report. Number 1, the report should address or answer any specific clinical questions. If any factors prevent you from answering a clinical question, state these factors in the report. And number 2, follow-up or additional diagnostic studies recommended to clarify or confirm the impression should be suggested when appropriate. Based on the documentation issues, the case was settled on behalf of the radiologist. More closed claim studies are available online. All studies have been modified to protect the privacy of the physician and the patient. Thank you so much for watching.